Hi, and welcome to October's Wellness Moment on Heart Health. So for this presentation, we're going to be talking about heart health facts, the Simple 7 from the American Heart Association to help prevent heart disease, and what you can do to help prevent heart disease and help manage heart disease. So our goal is to help you manage your risk factors for heart disease and decrease your risk for heart disease. Heart disease is the leading cause of death in the U.S. for both men and women. It can sometimes be silent. This means that the heart issues, such as high blood pressure, can go undetected until someone is experiencing the signs and symptoms of a heart attack or stroke. It's important to know what puts you at higher risk for heart disease because of this. So the American Heart Association created Life Simple 7, and these are risk factors that can influence cardiovascular health or heart health. The Simple 7 can be controlled through lifestyle changes. Controlling your risk factors can improve your cardiovascular health and decrease your chances of getting a heart disease, heart attack, or a stroke. The first of the Simple 7 is managing your blood pressure. Blood pressure is the amount of force of blood flowing through your blood vessels. So if you picture your veins as pipes, it's the amount of force that's being put on those pipes. If high blood pressure is left untreated, it can cause damage to blood vessels and lead to a heart attack or a stroke. High blood pressure can be a result of smoking, being overweight or obese, having a lack of physical activity, or too much salt in your diet. Too much alcohol and stress can also contribute to high blood pressure. The second of Life's Simple 7 is controlling your cholesterol. Cholesterol is a kind of waxy substance that your body needs to help build cells. But too much cholesterol can be bad. Cholesterol can attach to other substances and form deposits and collect in the arteries, which can clog the arteries or break and form a clot that causes a heart attack or a stroke. High cholesterol is usually the result of unhealthy life choices. The third part of our Simple 7 is reducing blood sugar. While it may not be harmful to have high blood sugar for a little while, over time, higher levels of blood sugar can cause damage to the heart, kidneys, eyes, and nerves. Individuals with higher blood sugar are more likely to be obese and physically inactive, which puts them at a higher risk for cardiovascular disease too. Being overweight or inactive can lead to insulin resistance, which also leads to higher blood sugar. Getting active is also important as part of a healthy lifestyle. Being physically active is one of the best things you can do for your heart health and your overall health. Being physically active does not mean you have to start joining a gym or run marathons. You can simply start by walking more, or maybe start walking in a pool if that helps with your joints. Getting enough physical activity can prevent 1 in 15 cases of heart disease. Eating better. A heart-healthy diet includes watching your portion sizes, eating more fruits and vegetables, choosing whole grains over refined grains, limiting how many unhealthy fats you have, so saturated or trans fat. These are solid at room temperature versus the healthy fats are liquid at room temperature, like your plant-based oils such as olive oil, canola oil, avocado oil, or any of those other plant-based oils. Choose lower fat protein sources. Reduce the amount of sodium you eat. And try to limit your fried foods as well. Losing weight. Extra weight can place a large burden on your heart by making it work harder than it should. Losing 5 to 10% of your weight can lower your chances of developing heart disease and improve your blood pressure and cholesterol. So it doesn't have to be a large amount of weight loss. So for someone who weighs 200 pounds, this could be as little as 10 pounds. For someone who weighs 300 pounds, it could be as little as 15, and so on. Stop smoking. Smokers are at a higher risk for developing cardiovascular disease and diabetes, which is a risk factor for cardiovascular disease in itself. Cardiovascular disease deaths that are caused by smoking are 100% preventable. The health benefits from quitting smoking are immediate, but they also lead to long-term benefits as well. So do you know what your risk factors are? When was the last time you had your blood pressure checked, your cholesterol? How about your glucose? What risk factors can you control? What's one thing that you can do to improve your health and reverse those risk factors? Are there non-controllable risk factors that you have? These are things that you do not have control over, such as age, race, or genetics. So to learn more about some of your risk factors for heart disease, make an appointment with your healthcare provider to discuss your risk factors and your lifestyle changes that you can make to improve your heart health. We also have condition management programs such as diabetes management, hypertension or high blood pressure management, high cholesterol management, and others to introduce you to exercise or start improving your weight management. So if you're interested in any of these, please let me know. If you want to learn more or have any questions about what you can do to improve your heart health, make an appointment with your Everside Health clinician or your own primary care physician. If you do not have a primary care provider and are not on the City of Dayton insurance, email me and let me know so I can help you get connected with a primary care provider. Here's our location and hours of operation. Please note that now on Thursdays, we are open at 7:30 a.m. instead of 10 a.m., and we are still open until 7 p.m. If you have any questions, please email me at sarah.wiseman@healthstatinc.com.